Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. In this edition, we're actually going to talk about the importance of keeping your license and do physicians have the final say so? You definitely want to know what I'm talking about, don't you? Stay tuned. Welcome back. My name is Dr. Marita P. I'm a registered nurse. Been a nurse for 17 years. OBGYN is my specialty. Well baby nursery is my specialty. I'm currently a nurse educator and I teach at HBCU and I'm doctorally prepared. All right, with that out the way, let's dive into this topic. So, do physicians have the final say so? And what inspired this video is a TikTok that I think someone had asked me a question and I replied to, and then a physician steps in, two physicians step in and tells me that they make the final decision. And no, physicians don't make the final decision. Now, before you all come and be like, okay, well, yeah, we have to listen to the doctor's orders and on and on and on. Of course we do. Of course we do. But let me paint this picture for you and let me explain to you why it's important for you to know the nursing process and to know what your job is and how to do your job. We do, as nurses, do not blindly follow physicians' orders. Physicians are human too. They make mistakes. And there have been plenty of times where I have covered a physician in the sense of I found something wrong, let them know, they thanked me for it or didn't, and it saved the patient's life. So when I say we comply with physician's orders as long as it is safe for the patient. So be mindful of that. This is more so for my new grads and just people who just, I guess, don't know. We follow orders as long as it is safe for the patient at that time. We comply as long as they are safe. Now, when doctors write orders, they write them either as a standing order or they write them based on the patient's current condition, right? With a few, PRN meds for variations of the condition, in terms of they get nauseous or, a headache or something like that. So we have a few PRN medications for those types of situations, but they're ordered. So to give those if you need them. But there are times in which the doctor has ordered something that is not safe for your patient at that time that you do your assessment or the time that the medication is due. Here's an example. So if I have a patient, actually had a patient who she had a blood pressure. She was on methyl-dopa. She's got 500 milligrams twice a day, BID. And for her 9 o'clock dose in the morning, her blood pressure was like 80/40. So just because the doctor says to give the medication and it's ordered for 9 a.m. 500 milligrams, with the blood pressure like 80/40, she did not need that medication. So in her best interest, I held the medication. Now you may say that's common sense. It's common sense for those who have sense, okay? Because a lot of us here don't. We do not comply with an order that is not in the patient's best interest. So with that situation, what do? You simply call the physician, say the patient's blood pressure is 80/40. I'm holding this methyl-dopa in this case. And they should tell you okay. They should tell you okay. Now they may want to know why is patient's blood pressure so low. And you may have to give some backstory, or maybe, I don't know, maybe they had some narcotics, maybe whatever happens to be. It could be some reason as to why their blood pressure is low to begin with. But nonetheless, you're not going to give a medication just because it's scheduled, just because of the fact that the doctor said so. You could cause harm to a patient. And at the end of the day, you are the nurse. You're the person, typically it's the nurse, who always comes in contact when an intervention is done, when an order is to be carried out. It's typically the nurse who's the last person who touched that patient before that order was carried out. And with that being said, if you're the last person who does that, you're the one who's responsible, not that physician. So if you blindly follow doctor's orders, so you go ahead and give that 500 milligrams of methyl-dopa, knowing the blood pressure was 80/40, you are held liable, not the physician. So again, when orders are written, they are correct, hopefully, at the time that they're written. If they're not correct, you have a responsibility as a nurse to clarify with that physician. Is this what you really was trying to give? Is this what you really want to do? Because, of course, have your evidence as to why this is not or rationale as to why this is not a safe thing to do or whatever happens to be. But what I'm saying is, if you, and there in the TikTok, there are physicians saying, no, you're supposed to do what I say to do. Physicians, this one physician says, I make the final decision. And I'm like, no, ma'am, you don't. No, ma'am, you don't. Physicians do not make the final decision. If they want to do something that's going to harm the patient and you know it's going to harm the patient, then let them do it, which typically they can't. But let them do it or find somebody else to do it. I'm not doing it. I refuse to do anything that's going to hurt my patient. And then furthermore, hurt my license. Because I guarantee you there's no physician out there who's going to, I'll say none. There's very few physicians, if any, who's going to back you up and say, you know what, I did make that mistake, I'm sorry. And even still, the nurse will go down for it. Why? Because she's the one or he's the one who did the action. Because when you go to court, they're going to say, did you not know you have a license? Did you not know that you shouldn't be doing X, Y, and Z? What are you going to say then? The physician told me to do it? No, they're not going to use that as an excuse or grant you to use that as an excuse. They're not. So we have to be mindful that our job is so important, because think about the case that was here in Tennessee, where I live at. I'm at Vanderbilt. If you don't know anything about it, type in the Vanderbilt case, nurse case. And this nurse, again, did something she wasn't supposed to do. And as a result, we lost a life. And she, of course, went to court and she's lost her license and things like that. And that's an extensive case, so I won't get into it here. But you can always go read the deposition. All that was public. The hearing, a lot of that was public. So, you can read about it. She lost her license because of that. And it wasn't the physician's fault in the sense that he wrote the wrong order. She pulled the wrong med. Or he or she wrote the wrong order. They did not do that. She just pulled the wrong med and gave it and did not do her rights of medication passage and things like that. So with that being said, we have a responsibility to our patients. We have a big responsibility to our patients to know how to do our job and to be advocates for our patients, protect them at all costs. And sometimes the physicians don't have the nurses, or not nurses as well, but sometimes physicians don't have the patient's best interest. And then keep in mind, you as the nurse are there for 12 hours. That physician comes in for 15, 20 minutes. You will have the best eyes and ears and voice for that patient. The physician does not. So I want to challenge you that when you're being challenged by a physician, that you make sure you have your facts. You make sure that what you're doing is based on evidence-based practice and research. You also make sure what you're doing is sound and safe, and that you report and document everything that you've said and done to the physician, as well as document it in the chart. Document, document, document. That's what you have to do. Also, when it comes to taking care of your patient, you want to be mindful that the doctor, the hospital, they will all kindly throw you up under the bus, as I say. So again, protect yourself, protect your license. Nobody cares about you than you. I've said in a previous video or another video, because it may go up after this one, that you are a liability to a hospital as a nurse. You're not an asset to a hospital. You don't make the hospital money. You charge them. You make them spend money on you. You are a liability. You don't bring in any income. Doctors bring in income. We exhaust a lot of the income with your 401ks, with your insurance, with your just things like that. So with that being said, again, nurses are really at the bottom of the totem pole, unfortunately, in healthcare. So I want you to be mindful. Do not do that. So I'm going to share a brief story, just for the sake of time, about how, what to do in a situation where the doctor doesn't listen. Keep in mind, there's always a chain of command. You should follow your chain of command. So you should always talk to the charge nurse and go to the nurse manager and go to whoever. If you happen to be at night shift and your manager is not there, then you go to your charge nurse and then go to the house supervisor in the hospital setting. And then whoever else the chain of command happens to be. Find out who your chain of command is, and that's who you go through when it comes to your patient care situations. So in my situation, I had a situation where a patient needed to be removed from my unit. She was on postpartum. She was had some serious issues, and she needed specialized care that we did not provide on postpartum. I needed her to be moved to ICU. I called the physician several times to say this is the situation with the patient, and he was like, no, she's fine. She can stay where she's at. And so I said, well, at least come in and see her because she is really ill and I feel like she was going to die that night, and she would have. He said no. I said, okay. So what did I do? I called a rapid response. So a rapid response is basically a backdoor method to get the help that you need for your patient. That's exactly what I did, not do it again. As a result of me calling rapid response, she ended up getting moved to step down. I got her to step down, not step down, step down, to step down, yeah. And as a result of her going to step down, the nurses had looked at her for 15 minutes and said she needed to go to ICU. I said, I've been trying to get her to ICU all day, And by that time, by 10 o'clock that night, they transferred her to ICU. Again, she would have died that night if I had not did what I did that day by calling the rapid response. So sometimes your physicians, again, they're not there long enough to really assess the situation and make a good decision. If you are a new nurse and don't know, you need to go to someone who has more experience than you, who is better qualified to make those kind of decisions, and just kind of talk the scenario over with the charge or somebody else with seniority, who is seasoned, who is quality nurse. Now, I'm not saying just because somebody's been a nurse longer than you don't mean they're a good nurse. So let's go ahead and just dispel that. But make sure that the person is someone of substance, a nurse of substance, but that you go and get help from if you don't know what to do. So be mindful of those things. If I hadn't have called the rapid response, my patient would have died. And it would have been my fault that she died. Not because, you can't say, well, the doctor said that he wasn't coming. Okay, and if I happen to know that my patient needs care that she is not getting, and she in my situation, because they're all OB patients or GYN patients, then I'm going to take what's called the backdoor method. For me, is rapid response. At our hospital. Your hospital may have something different. Again, follow your chains. I'm not telling you just call rapid response just to be calling. But truth be told, a rapid response is a way for you to get a different set of eyes on your patient without going into the whole code blue status. So a rapid response team is there to kind of put eyes on your patient to say, okay, this is the situation. I need y'all to come up, look at my patient, and we're going to figure out what to do with my patient. And we try to find out what's wrong or get help for my patient before she in my case, turns into a code blue situation. So that's what a rapid response does and what it's for. If you can't get your physician, you can't get help from anybody on the floor, you can't get your house supervisor, you can't get the nurse manager, call a rapid response and get help like that. And so I always advocate for my patient. And so sometimes I'm making this whole video to simply say, you cannot blindly lead physicians' orders just because they say to do X, Y, and Z. That is doing your patient a disservice as well as yourself a disservice. You will be unemployed and unlicensed if something happens to that patient that is detrimental. It's one thing to lose your job. It's another thing to lose your license. Never be afraid to lose your job. Never be afraid to lose your job. I will walk away from a job any day, but I have a license that I have to maintain. So hopefully that helps someone somewhere where you have thought about, been in situations where, the doctor says to do something that was clearly not right and you knew it was not right. You have proof that it was not right. You do not blindly comply with patient's orders that is unsound for your patient. You just don't do that. So I just want you to know that you have to advocate for your patient. You are the best advocate for them. You need to advocate for them. And at that point in time, again, document your findings and things like that and make sure you stay on top of things when it comes to that. All right, so this concludes this video on, do we need to comply? Do they have the last word? Again, the answer is no, they don't have the last word. Nurses actually make the decision at the bedside to say, okay, am I going to comply with this order or am I not going to comply with this order? If you make a decision not to comply with an order, you have to have a reason. And it better be a sound and evidence-based practice reason, and it better be something that you can prove. You can't just say, well, I don't want to do vital signs, so I'm not going to do it. No, we have to comply with those orders. But we have to, make sure that whatever we do is in the patient's best interest and be an advocate for our patient when no one else happens to be. So thank you for following me on my channel. Please subscribe, share, comment. I enjoy your comments in the comment section. Please, I would say this, keep them respectful. There's people on here who think they can come and say anything to a stranger that they don't know that I won't come back for, because I will. And I always will finish the scenario. So don't ever come talking crazy over here, because it's not going to work for me. It doesn't work on TikTok either. So with that being said, though, definitely I love healthy dialogue. And if we can have a healthy conversation about whatever, that's great. Please put that in the comments below. Follow me on IG or TikTok if you so choose. A lot of the stuff goes on in TikTok world, believe it or not. Like, they have some excellent questions. I do a lot of live over there, Q&As over there. And I bring that content here. Something I really want to expand on, I bring that here. So definitely follow over there, like, share, comments. And until the next time, you all take care. Bye-bye.